Okay, good afternoon, Charlotte. Thank you for the opportunity. I've been in all the sessions all through. I actually reserve a seat for all the sections. So why I decided to join this is because there had been an outbreak lately in where I stay. I base in Sokoto, Nigeria, and I work in with UNICEF as social behavioral change consultant in a local government, Quarry to be precise. So there was an outbreak of malaria of recent in this region of ours due to the heavy rainfall and flood in some of those communities. So I just want to learn more on how I can impact and change. And there's been weather change here. Actually, there's climate change over here. The weather has drastically changed, and the mosquitoes are still persisting over here. And so, although there have been some little interventions from malaria consortium to help curtail and administer some free drugs to the children and mosquito net to the caregivers, but there are still some communities that are still hard to reach because of insecurity, because we suffer it here in the north very well. And so, because of that, I just want to learn better ways on how to help and from other participants to find a way to help and assist those in those difficult, hard to reach villages or communities, because it's actually a burden. Because of here, there's banditry and kidnap here very well, so we can't reach out to them and support them. So I'm also looking forward to seeing to learning ways on how to we can afford to send them help in those places, because we actually get reports of high number of deaths due to cerebral palsy and malaria there. So thank you very much.
Okay, thank you so much, Maman Godiya, for sharing. And you mentioned climate change and health. And just to let you know, as I'm sure you already do, and that you have reserved your spot for the session after this one, which will be with Grand Challenges Canada, focusing on climate change and its impact on health. So we have Ukasha Sultan. Ukasha, earlier on you were unmuted. Please, can you go ahead and unmute yourself? Again, and I'm also curious to hear from Angelina Jato that I'm inviting to unmute. Ukasha, are you able to unmute yourself? Your hand is raised. Okay, over to you.
Good afternoon, everyone. I am Ukasha Obakar Sultan from the Federal University of Health and Science, Azare, Bauchi State, Nigeria. So I'm very, very interested about this program. This issue of malaria. The malaria is very, very, let's say the climate change has affected all the health workers in town. So because of this malaria, it's affect our people, especially in my zone, Northeast.
Okay, thank you so much, Ukasha Sultan. So, and just so you know, like Reda said, this is a sneak preview of the malaria special event that we are going to the Geneva Learning Foundation in partnership with the Rollback Malaria Partnership to End Malaria. Will be holding. That is next Tuesday. That's the 10th of December. And so I put the link in the chat if you have not yet requested your invitation and registered to join. But if you're on this platform, you should reserve your spot because spaces are limited. And Reda, I'm turning over to you because I know we are going to start the countdown.
Thanks, Charlotte. And wonderful to be here. We're 1 minute, 15 seconds away from getting started. This is a sneak preview. As Charlotte just said, we're holding a special event specifically for malaria with RBM Partnership to End Malaria. That is on Tuesday, the 10th of December. The time is going to depend on where you are in the world, but it's 12 p.m. So it's noon in Geneva and 11 a.m. Universal Standard Time. So we're 50 minutes, 50 seconds away from counting down. Today is a sneak preview. If you are watching this on the live stream, I encourage you to register, request your invitation, join the Teach to Reach platform. It's an amazing platform. We're 30 seconds away, so I'm not going to show you very much, but you can really meet, network, and learn. You can see here at the top right, there are more than 15,000 health professionals registered for this event, and you can access a full participant list, find people that you are interested in connecting with in various ways, as well as join these sessions to meet, network, and learn. Right after this session, we'll have the session on climate change and health, and then we'll have a final session entirely dedicated to networking. So I believe we should be close to the countdown here, and here we go. All right, a warm welcome to you from Geneva, Switzerland. Here we go. We're starting this. We're very excited about this session. Of course, this is malaria is an issue, an affliction that affects all of us. And this is why we're very pleased to be welcoming RBM Partnership to End Malaria as a new Teach to Reach partner. We'll show you exactly how RBM framed its engagement in supporting Teach to Reach. Charlotte, I'm going to ask you to read it, of course.
To end malaria, we must empower the people closest to the problem. That's health workers in affected communities. This partnership with the Geneva Learning Foundation allows us to listen to and learn from those on the front lines of malaria control, ensuring that their voices drive our global strategies and actions towards elimination.
All right, wonderful. And we are, this is a sneak preview today, and we're then holding a special event on Tuesday, the 10th of December, Health Workers United to End Malaria. Now, there are already outputs of Teach to Reach 10, really focused on health worker perspectives on malaria. You can see some of them here on screen. We invite you to, everyone who registers for the malaria special event will automatically receive the eyewitness report. Now, ahead of Teach to Reach 11, we asked you a number of questions when we introduced the partnership around how malaria has impacted your life, your family, your community, and then to share how changes in climate and adverse weather have affected malaria in your community as well. So it also a much more detailed set of questions in both French and English, as you can see here, to share experiences with malaria. Charlotte, is there, of the 10 questions that we asked, is there one that you feel is particularly important from your perspective?
Whether it's hard to choose, all the questions are quite significant. But the first question really speaks to me because malaria actually affects me, my immediate family, and my community. And it's something that I really have a passion when it comes to tackling it. So I'm also very much interested in the questions around how communities and members of the community get to use insecticide-treated bed nets.
All right. And then we also had a question specifically on malaria vaccination. So these, we started asking them at Teach to Reach 10, and we've continued to ask them through Teach to Reach 11 to continue collecting, really helping you share your experiences. And of course, this is something that we're going to give back after Teach to Reach 11. The experiences shared collection for Teach to Reach 10 is already available. And I suggest, Charlotte, that we start there, really looking at, and let me see how I can bring this up on screen. So we asked these questions, and we saw, for example, from Afghanistan, Syed Ashukula Majidi, who's a public health specialist for a national NGO who works in Logar, Faryab, Samangwan, and Parwan, who says, we have a malaria project at the community level to decrease cases at provincial level. We regularly follow cases and treatment considering malaria guidelines. And he also says, my family members are healthy and not affected by malaria. So that is one example of a health worker testimonial in response to these Teach to Reach questions. We're going to now open up to the Teach to Reach participants. If you are watching on YouTube or another social media channel, we see your comments. There's a little bit of a delay, so we know that. So we'll be looking for your comments coming in. And then for those of you who are with us on the conference platform, we'd like to invite you to tell us about a specific time when severe malaria affected someone close to you, your family member, friend, or patient. What exactly happened? What did you do? And how it turned out. So we're going to start, perhaps let's see if Gladys, Abena, Osua, Gideon, Johannes, Naomi, Joshua, Muazu, Ukasha Sultan, your microphones are active. Please go ahead and either raise your hand or just unmute if you'd like to share with us. And we have actually two hands raised already. So Margaret Nabagala, as well as Joseph and Gugi. So Margaret, we're asking you to unmute. Joseph, we heard from you, of course, and you're a long-standing member of the Teach to Reach community, a leader as a scholar in the Movement for Immunization Agenda 2030. Joseph, would you like to kick us off and tell us how malaria has affected you?
Yeah, good afternoon, morning, everyone. I'm Joseph Gugi from Murang'a County, Kenya, and I'm a community health officer. Malaria had affected my wife. In fact, about 3 weeks ago, and she could not even move. She was feeling cold, headache, and she could not do any activity. It took her 3 days to heal, and in fact, she had to be injected instead of taking the oral medicine, and that one affected her activities, and also it affected me. It affects us both psychologically and the whole family. Thank you.
Thank you, Joseph. That sounds very recent. Do you think it's different for you as a health worker? You, of course, probably know a lot more than many people that are not health workers. Do you see any other differences in terms of how having your wife, your other half, affected and severely so? It sounds like. Is there anything different from your perspective because you are working for health?
Yeah, I saw it differently. I saw anybody can be infected with malaria, regardless of wherever or she is. Sometimes it's not something. It's beyond somebody's control because he has gone to a prone area malaria. So anybody can be affected by malaria.
And Joseph, if you had one question for your colleagues, including those who are specialists in malaria, who really they work for the National Malaria Control Program, what is it that you would like to know through Teach to Reach? What are you expecting what are you hoping to hear in terms of the experiences shared and the knowledge that health workers have about this disease?
I'd like to know more about the malaria vaccine.
Okay. Yeah, understood. Yeah. All right. Thank you so much, Joseph. And thank you for contributing to Teach to Reach once again. Now,
thank you.
Let's go to Margaret Nabagala. I hope I'm not mispronouncing your name. Margaret, we'd love to hear from you. And thank you.
Yes, thank you very much. Hello. Do you hear me loud and clear?
Loud and clear, yes.
Do you hear me? Okay, I'm called Margaret Nabagala Ntambazi, and I'm a Ugandan. I'm a public health specialist. About malaria, actually, the experience I had a colleague of mine, a very close friend of mine, had a child about 5 years old who suffered from malaria very recently, and we had to really all panic because the child was seriously sick. We had to take the child to the hospital. The area that I come from in Uganda is southwestern Uganda, called Masaka City. So we had to go to Masaka Regional Referral Hospital. We took the child to the hospital. The child was really very ill. They had to put her in intensive care unit. They had to put her test-net drip. And sooner or later, the child improved. In 2 days' time, the child was discharged. What we had to do as public health specialists is to make some health education talks in my area. and the area where that child is coming from. These days there's a lot of rain. Rain is very, very much here and there. So and the shrubs are growing so high. People are growing maize, and maize has this kind of flower where mosquitoes hide. And so we had to make public health, we as public health specialists, we had to make health education talks to the villages. We had to organize community dialogues. We had to tell them about malaria and how it spreads. And the best control is to see that these shrubs that grow very high up, especially during rainy season, that they slash them, and also try to avoid growing maize very near the house, and also different methods of the measures of controlling malaria, like closing doors and windows before night, and also sleeping in insecticide mosquito nets, and also avoid using the nets. The government gave out so many nets to each family in Uganda, but some people use them for spreading maybe coffee on them. Others use the nets for other, like fishing. So we tried to tell them to not really to use the nets in that fashion, but to see that each and every person at least sleeps in under insecticide mosquito treated nets. And this is how we go. So people have really complied, and we shall have to arrange more of such talks. Thank you very much. Over to you, Chair.
Thank you, Margaret. We're not quite done with the questions. What would you like to learn through Teach to Reach from the experiences that others are going to share? Can you give us one question that you are especially interested in, a problem that you're facing, where you would welcome support and feedback and insights and ideas from your colleagues?
Thank you very much once again. Yeah, I would like to learn about malaria, because they have been promising that we have been immunizing against so many other diseases, but malaria, and with Uganda, malaria is very rampant. It is number one killer. So what we are looking for is when will this immunization against malaria come? And also because much as we health educate people about prevention of malaria, still many don't comply, others don't really stick to what our advices are. So the best thing would be a production of immunization against malaria, so that we vaccinate it and put it in our routine program, so that each and every child, and maybe even adults, if possible, be immunized against malaria. So I would like to learn about that. Thank you very much once again.
Thank you very much indeed. Now, this today is a what we call a sneak preview ahead of the main special event we'll be holding on malaria. Let me show you what that looks like. If you go to www.learning.foundation.
Excuse me.
Yes. Oh, I think Margaret maybe had additional things to say. We'll go back to her. But here, just want to show you, make sure that everyone who is participating in Teach to Reach 11 today on Thursday understands that the big special event focused on health workers united to end malaria. So sharing of experience, exploring many more questions. I'll show you some of the questions we'll explore after this sneak preview and on Tuesday. So think of a particular moment when you could not get malaria medicines or tests when you needed them. Can you walk us through what happened? That's what will be one of the questions we'll ask you on Tuesday. And if you received a guest of honor invitation this morning for Teach to Reach 11, we realized that was last minute, but we wanted to include all of those of you who have contributed experiences about malaria for the special event, and we'll be inviting you as guests of honor there, where you are expected. Another question we'll be exploring: what do you do in your work to ensure that pregnant women do not get malaria? About prevention as well as treatment.
Excuse me, 1 minute.
Yes, go ahead, Margaret.
I just wanted to extend my apology. I was invited as a guest of honor, but I had some sick patients. Actually, my mom is sick, and I was not there at the opening session. So my apologies. Thank you very much. That's what I wanted to say.
Okay, thank you so much, Margaret. We hope that your family is going to get better soon. And thank you for joining for this afternoon session. So we'll be exploring many different questions at the Tuesday special event, a time when your community came together to fight malaria in a way that really worked. We'll ask you then, what exactly did people do, who got involved, and what made it successful? And then we'll ask you to describe a specific moment when you noticed changes in the weather over time were affecting malaria in your area. So this is related to climate change, but it's hard to tell if climate change has actually happened or not. And then, as I said, we'll also be sharing on Tuesday the collection of health worker experiences. We've shared one collection already with RBM, and this is a full set. We'll just give you a sneak preview. We showed one from Afghanistan, but there are contributions from many other countries: Burkina Faso, Cameroon, the DRC, Ethiopia, Gambia, Ghana, India, Kenya. You can see the different contributions here, and those who took the time to answer these questions, one or more of the Teach to Reach questions, are the ones who will be invited on Tuesday. We're invited today for this session as guests of honor, but as you can see, this is a very rapid sneak preview. From Nigeria, of course, many contributions as well that you can see here. I'm just scanning through a few of them, but we'll be really digging into these questions on Tuesday, the 10th of December at these special events. So we hope that you will not miss this due to connectivity or other challenges. So we're at the 15-minute mark. We have 15 minutes remaining to listen to your voices. Charlotte, I did see some hands that had been up that are down. Who shall we hear from next? Of course, we privilege those who we have not yet heard at Teach to Reach. Please guide us.
Loretta, we have Kingsley Ninyere, who has already spoken before, whose hand was raised, but also Andrew Nina. I hope that your audio devices and your connectivity will allow you to speak. I'm inviting you to unmute. Your hand is raised. And I know Kingsley Ninyere is quite passionate about malaria, Reda. So I kind of like I would not feel good not to allow him to speak during this session. We should have time
to hear, to hear a few more people. Yeah. So, yep. So we're asking.
So I'm also asking Angelina Jato. Earlier on, your hand was raised. I don't know if you waited. Okay. So Angelina, are you able? Okay, over to you, Kingsley, and then after you will listen to Angelina.
Right.
Thank you very much for the opportunity. I'm Kingsley Kofi Ninyere. I work for Community Development Foundation based in Ghana, Kintampo in the Bono East region. Yes, malaria is actually a deadly disease in my area. My family has been affected by malaria. I myself have suffered from malaria, and my sisters too as well. Especially my sister, who was pregnant during rainy season, went to the hospital for ANC, and lo and behold, she was told that there's no IPTP. And you know, IPTP is given to pregnant women 5 times before delivery. And this IPTP protects the unborn child as well as the mother. But what happened here is that she had a malaria, which is to say malaria in pregnancy. And at the end of the day, there was anemia as well. And consequently, she missed the pregnancy. And it is something serious that is happening in my area here when it comes to IPTP uptake to prevent pregnant women from miscarriage, to prevent pregnant women from anemia, to prevent pregnant women from maternal death. So here, I do encourage that if you go to the hospital with that IPTP, then make good use of the ITN. Make good use of the ITN. So the ITN can protect you from mosquito bite. And also what happened here is that during rainy season, they make sure that all the waters that are in their containers, they cover it. Some have been telling me that
they sleep well in the mosquito net. But what happened here is at the end of the day, they'll go to the hospital and they are confirmed malaria positive. And I said, yes, the issue has to be with outdoor. During outdoor activity, you have to wear things that can cover yourself, your entire body, to prevent malaria from, to prevent mosquito from being biting you. So aside that, that is what I've been doing, sensitizing the community members and sensitizing the pregnant women. And you know, children under 5, they are most vulnerable. The pregnant women and the children, they are most vulnerable. Even though all of us is at risk of getting malaria, but pregnant women and that of my and the children, they are high risk. So anemia in pregnancy, miscarriage in pregnancy, and then whatsoever has been the challenge. And I've been doing a lot in collaboration with Ghana Health Services to sensitize the community members about the importance of using mosquito nets. Thank you, and I'm over.
Thank you, Kingsley. So the same question that we've asked the other speakers, just to understand, what would you like to learn about from your colleagues' experiences? So that's different from learning from experts, learning about things they have actually done, perhaps around this issue of prevention for pregnant women, or this question of supply of medicine, availability of medicines in situations where they're critically needed. What kinds of experiences could be useful to you? How do you can't solve a supply problem just on your own. So what would be most helpful to you, and what are you interested in hearing from your colleagues?
Thank you very much, Executive Director. Hearing from my colleagues as to how to make sure that this malaria endemic in our locality, we sensitize the community members about the dangers of mosquito bite, so that they can prevent themselves from mosquitoes. And also, they make sure that they clear their gutters, prevent mosquitoes from breeding, so that they cannot be. But quite apart from that, the drugs and then the test kits, that is to say RDTs, are not available. So policymakers and then partners can come to our aid to help us come out from this particular challenge.
Thank you very much indeed, Kingsley Nyere. So we hope we'll be able to put these questions to the group that will gather, to the malaria community that will gather, and we'll have, again, because we're working in partnership with RBM Partnership to End Malaria, we hope to have a number of country and global partners, so national program managers as well as global partners that support malaria efforts in Ghana and elsewhere. Thank you very much indeed, Kingsley. Now, given that we have to start the climate change and health session, let me just do a point of order. We have time for maybe to hear from one more person, and if this short session leaves you thirsting for more, well, that's exactly the point, because again, this is a sneak preview of the special event that will be held on Tuesday, 10th of December with RBM. So right now we are this has my bookmarked sessions, but these are out of order. So remember, in order to actually join the session and be able to speak, you need to first join the conference platform. So everyone who requested an invitation was pre-registered and is able to access just by clicking on the link. Otherwise, you do have to go through a free registration process. And to join this next session with Grand Challenges Canada, you'll need to reserve a spot. And that is when you can see that you are able to join the climate change and health session. If you do not reserve a spot, you will not be able to join the session, and therefore you will not be able to participate. I think this has confused a number of people who are looking for something, who don't understand, who are staying in the lobby where the event is being streamed, but where you're not able to interact in the chat or request to speak by raising your hand. So Charlotte, perhaps one last speaker, and then we'll have to close this session actually quite quickly before we in order to start the climate change and health session.
Yes, Reda. So I'm inviting Berry Gariba. Very good to have you on Teach to Reach. Are you able to unmute yourself and speak to us?
Yeah, Charlotte, thank you. Thank you, Rada, for having me here. I'm so excited to be with the team again. We were together in the vaccination session some years back, and I'm now with the malaria crew. Actually, I'm Berry Ani Gariba, the Monitor and Evaluation Officer for malaria for the Northwest region in Cameroon. So I'm happy to be with you.
All right. And Barry, could you tell us about a time when severe malaria affected someone close to you? We only have a couple of minutes, and I know these can be difficult circumstances and not easy to speak about. But if there's anything you'd like to share, we'd love to hear it before we close this session and go to the climate change and health session.
Yeah, the most interesting part of that I will talk of is what concerns me directly. You know, some 2 weeks ago, given the workload that I had some fatigue, some little fever, and I just said to myself that maybe it's work, is the workload that I had. We did the rapid malaria tests, and it wasn't reactive. Maybe the technician who did it didn't follow the instructions very well, but I still felt bad. And unfortunately for me, I was out of station. We were in the field doing some supervision work, and I really felt bad. I said, okay, let me just go to the hospital and check. Behold, the microscopy showed I had severe malaria until I had they call it Coca-Cola urine. So it was actually severe. I was given some bed rest, and I had to take my drugs. And fortunately, I came out of it. And I really felt bad. And I thought of, if I were not a health personnel, or maybe I was not where I had easy access to the health facility, it could have degenerated into something else. So I personally, I suffered from severe malaria some 2 weeks ago. So I know what it is, and it's really bad.
Thank you, Barry Gariba. We need to close this session now, but again, if this leaves you wanting more to share with colleagues from all over the world who are confronted by malaria, join us on Tuesday for the special event. We have more sharing that is just getting started. We'll continue on Tuesday. We're now moving to the climate change and health session. So this is going to require actually leaving this room, going back to the lobby, and then rejoining this time, joining the climate and health session. Remember, you need to reserve a spot. Otherwise, you will not be able to join the platform. I hope that's clear for everyone. Once again, thank you and goodbye. See you hopefully see you in a couple of minutes. Barry Gariba, Tijani Suleiman, as a special guest of honor, you'll be invited to speak on Tuesday. This is a mini session, so we hope you'll bear with us, and we ask for your indulgence. See you soon.